What is PCSK9, and how do inhibitors lower cholesterol? Imagine a tiny protein in your body that can influence your risk of heart disease. That's what PCSK9 is, short for proprotein convertase subtilisin/kexin type 9. It's mainly made in the liver and plays a big role in controlling cholesterol levels. PCSK9's main job is to interact with LDL receptors on liver cells. These receptors are like little vacuum cleaners that clear out bad cholesterol, known as low-density lipoprotein cholesterol, from your blood. When PCSK9 binds to these receptors, it causes them to be broken down inside the cell. That means fewer receptors are available to remove LDL cholesterol from your bloodstream. If you have more active PCSK9, you end up with fewer LDL receptors and higher levels of bad cholesterol. This can increase your chances of developing heart disease or having a stroke. Some people inherit genetic mutations that make PCSK9 more active. These are called gain-of-function mutations and can cause very high cholesterol levels, a condition known as familial hypercholesterolemia. On the flip side, some mutations reduce PCSK9 activity. These are called loss-of-function mutations and lead to more LDL receptors, lower cholesterol, and a lower risk of heart problems. Now, here's where PCSK9 inhibitors come into play. These are a newer type of medication designed to block PCSK9 from working. They are usually given as injections, often once every 2 to 4 weeks. When these drugs attach to PCSK9, they prevent it from binding to the LDL receptors. This means more receptors stay on the surface of liver cells, ready to clear out LDL cholesterol. Because of this, PCSK9 inhibitors can lower LDL cholesterol levels by a significant amount, sometimes up to 50% or more. They are especially helpful for people who have very high cholesterol that doesn't respond well to statins or who can't tolerate statins because of side effects. These medications are also proven to reduce the risk of heart attacks and strokes in people at high risk. In the context of other lipid-lowering medications, PCSK9 inhibitors are a powerful addition. Statins are usually the first line of treatment, but when they aren't enough, doctors may recommend PCSK9 inhibitors. They work differently but complement each other well. In summary, PCSK9 is a protein that increases blood cholesterol by reducing the number of LDL receptors in the liver. Inhibitors of PCSK9 block this protein, allowing more receptors to clear out bad cholesterol. This approach helps lower cholesterol levels and reduces the risk of cardiovascular disease, especially for those with stubbornly high cholesterol or genetic conditions.